So a big area of controversy in the world of plastic surgery is surrounding the concept of doing a Brazilian butt lift as a standalone procedure versus including some fat grafting in a procedure like an abdominoplasty or some sort of or other body contouring procedure. Idealistically, if someone's main focus is to rejuvenate the backside, then a Brazilian butt lift is a great operation. You definitely have better outcomes with regards to the overall aesthetics of the backside when performing a Brazilian butt lift in isolation. And the reason why is you have a lot more control over fat grafting viability because of the less pressure that you have to put on the backside, allowing you to kind of lay on your tummy when you're just doing a Brazilian butt lift, which for review just includes some liposuction from the front and flanks or other areas, as well as the back, and then injecting it into the butt. One of the challenges, and particularly in my patients, is that a lot of those individuals really have had multiple pregnancies, had significant weight fluctuation, and still want butt rejuvenation, but also want truncal rejuvenation at the same time, which would include something like a body lift, or in most cases, a full abdominoplasty or a tummy tuck. So in these cases, my discussion with the patient hinges on the idea of, well, what's the goal of the surgery? In this case, their main goal is to get the maximum amount of rejuvenation done at the same time. So for them, the idea of coming back and doing two separate operations, which in some cases would include liposuction of the abdomen and fat injections, followed by a tummy tuck as a second stage, is just not really an option for them. So the approach we take is that our goal is to get the maximum amount of rejuvenation at the same time. So that would include, improvement of the abdomen, shaping of the flanks, and then since we have the fat, as we pull the fat out with liposuction, instead of throwing it away, we're simply going to take what we have and injecting it in the butt, with the recognition that we'll probably have a lower graft survival rate, but at the same time, a much greater improvement in the overall aesthetics of the patient at that one surgery. So just in review, this is an example of a patient who underwent a tummy tuck at the same time as doing some fat grafting secondary to liposuction. And you can see she has significant excess skin in fat along the back line in addition to the flanks. And so what I did is I liposuctioned that area, processed that fat, and then subsequently injected into the butt to improve not only the flank shape, but also the buttock shape, the roundness, and the projection. We also did a little liposuction of the lower buttocks to help improve some of the curvature or the A-frame area of the lower butt, in addition to a lot of liposuction on the upper buttocks to help shape the upper portion. So this is a common surgery in our practice, and I think it's a great approach for those individuals that just want to try to accomplish this in one surgery.